and he's the past president, Sri Lankan College of Obs and Gynae. So we are lucky to have Professor Rohana here to welcome all the quiz participants. So Professor Rohana.
Thank you, Dr. Alia, for that kind introduction. I must just make a small correction that I am not currently the president or chairman of the Menstrual Disorders Committee, PO. I am the past chairman. So just a small. But so I am good evening to everybody, and I'm very happy to be able to join this quiz program. I know it is a novel program, and everyone is very excited about this program. And when I sent it to the executive board, they were very interested in this quiz program. And I am thankful to this Dr. Alia, the chairperson of the Oncology Committee, and Dr. Bhagya Lakshmi, the co-chair of the Oncology Committee, who have been very active in their committee activities. And I can remember them celebrating the last year also this Cancer Elimination Day. And it was a very good program with a difference where they really welcomed and the leaders of cervical cancer elimination in the region were honored, and they were recognized. So it was a great thing to do a thing like that in the program. So I'm very happy that the committee has this year also started arranged a program to commemorate this day, because cervical cancer, as we know, is still a problem in our region. And so no country is in the direction of attaining the target which has been set by the WHO. And so the WHO says all countries should reach less than 4 cases per 100,000 women years by 2030. But at the moment, the incidence ranges from 7 to 23 in our region. So we have to go a long way. And also the deaths ranges from 3 to 13%. So according to the SDG 2030, the target is there should be a 30% reduction in mortality from cervical cancer. As we all know that this no woman should die of cervical cancer, because it is easily preventable. I mean, it is easily detectable and easily treatable at the very early stages. So it is very unfortunate if we still have women dying from cervical cancer. And I must also mention at this particular moment, the Oncology Committee is doing a project in Mizoram, India, with the aid of the Zero WHO in training personnel, doctors in this region on elimination of cervical cancer. They are training on the cervical screening, augmented BIA, and also treatment of precancerous lesion by thermal ablation and LEAP. So the committee is doing a lot of work, and we are very happy that we are able to be contributing to this worthy cause. So I also like to welcome all the participants, and I am very happy to hear that there are more than 225 joined, and out of that, more than I think 40 are contestants. So I think we will be in for a very, very tight contest, and so there is so much to be done in this quiz competition. So I won't take any much more time, but I congratulate the organizers, and I see Dr. Sadia also, our MFF, committee chair, and Dr. Niranjan also has joined from the Oncology Committee. So without taking any more time, I will hand over back to Dr. Alia and Dr. Bhagya Lakshmi to continue with the program. Thank you very much.
Thank you, sir.
Thank you, Professor Rohana, for your kind remarks and your encouragement. Always you are encouraging us for all these activities. So without wasting more time, and thank you, welcome Dr. Niranjan.
Yes,
and,
madam. Thank you.
Dr. Kritipal Subedi is also here, our Oncology Committee representative from Nepal. So Bhagya, do you want to say anything before we start the quiz?
I would request Dr. Sadia to speak a few words.
Okay. Dr. Sadia.
Hello, everyone. It's so nice to see everybody after a long time, after the Sri Lanka conference. And I got my teal scarf specially as requested for this occasion. So, and so nice to see Professor Rohana, Dr. Niranjan, Dr. Nayak.
Yes, ma'am.
And everybody here, and all the best for this very, very important webinar and quiz. This is really something which affects all the SAFOG countries, and you're taking it forward. Thank you so much.
Thank you, Dr. Sadia. Dr. Kritipal, do you want to say a few words?
Good afternoon, everyone. First of all, I would like to thank Rohana sir and the whole Oncology Committee for organizing this, although I am a part of this. And I would like to wish best wishes to all the participants and wish them all the best. Thank you, ma'am.
Thank you. And now our very famous Dr. Niranjan is here.
Madam. Thank you, madam, for that opportunity, and thank you, Bhagya. I think this was very different. The elimination of cervical cancer, which is our second anniversary. People are excited, and thank you, Bhagya, for getting this, the way the quiz has been done. And so many of my residents also wanted to join, but somehow the link has got closed. But I'm sure it is recorded and live on YouTube, and people can still log in and have a look. So I'm sure a lot of knowledge will be passed today, and the winner, I wish all the best to everyone, all our winners who are participating today. Nobody is going to feel bad. And thank you, sir, Rohana sir, and see you soon. It was a nice time to spend with you in Mumbai, and Aziza madam also for the workshop in September. And thank you, Bhagya. Thank you, Sadia madam also. I see so many of my friends there. All of you are there. Thank you, madam, for being there.
Thank you, Dr. Niranjan. And now, Dr. Bhagya, few words of wisdom.
Thank you, Dr. Alial. So, thank you, Rohana sir, for being here, and Dr. Sadia. So, I think we'll start on business now. So, request Dr. Alia to tell all the rules of the game to the participants. So, we have 55 people who are online now to play the game with us. So, I think we should get started.
Okay, so the first rule is that this quiz is meant for OBGYN trainees and residents, fellows who are 3 years post-registration only, not for senior consultants. So the senior consultants are welcome to be here and observe, but let the juniors participate. The quiz is designed in a way that we'll have 2 rounds. First round will be on Kahoot. It will have 25 questions. And of course, whoever has played Kahoot will understand it's very exciting. It's based on the current cervical cancer guidelines by WHO, and everything is evidence-based. The first 4 winners from the Kahoot will from different countries. So we will take 4 top winners from different countries, and we'll take them, we'll allow them in the second round, which will be the final round of the quiz. This will be played on the Jeopardy game, and this will be a knowledge plus case-based discussion will be in that game. So in that second round, whoever is the winner from each country will have the possibility of getting a team member from their own country. So for example, if somebody is the first winner from India, then they can take 2 more contestants who are present in the webinar from India as the team member, and then they can participate as a team in the second round. The second round will decide about the winning team. All right. And we have exciting prizes, which we'll announce later. All the attendees of the quiz will get certificates, e-certificates, but the exciting prizes will be announced later. So we want everybody to win, but of course there has to be some winner. Okay. So right now we have 54 participants. Now I will share the screen, and I am hoping that everybody has the Kahoot already installed on their phone. So everybody has to put their game pin, and as we have said in the instructions, that for the nickname, you can put your name plus in the bracket your country's name. So I'll wait for all of you to join the game.
They're still having issue with downloading Kahoot, because we had seen people from Bangladesh, India, Pakistan, everywhere, but now I can see only India, Pakistan.
Some people are not writing their name, so it could be.
Yeah,
I'll request whoever has joined, raise their hand, and maybe Bhagya, you can tell me when everybody is joined and I'll start the game.
Yeah.
So whoever has joined, please raise your hand.
Okay. Please go on. I think as of now, 27 have raised hands, so we have to wait a little more.
Okay.
Yeah, keep your hands raised. Once it's finished, then we will start the game. Keep your hands raised.
think, Bhagya, can I start now or?
Yeah, I think this we will take this as a mock round once. Surely we'll do it again though, because I think they're not used to downloading the Kahoot, and maybe I don't know, some problem has happened. start answering fast. Okay.
Wow, we have 14 answers correct. So the most appropriate test is HPV DNA testing. And let's see. Wow, we have top 3 from Pakistan only. And then we have India, and that's nice. So let's have the second quiz. You all have to be quick if you want to win. Wow. So according to WHO guidelines, if somebody does not have HIV, then the recommended age to start screening is 30 years. So Usman is keeping the lead, and Vrat from India is now second. And we have Bhavya from India also as second. So India is now taking the lead. I'm very excited now. Let's see if you can beat Usman from Pakistan. Yes, so 19 are correct. The 2-dose schedule is recommended by WHO if you have got for people who got their first dose before 15th birthday. So if you are late, then you have to have 3 doses. Wow, Usman, where you are gone? So now Prat is top. So we have, I don't know where Malindo is from, but we have top 3 from India now. Let's have the 4th question. Wow, I think it was an easy question. So we all know HPV 16 and 18 are responsible for 2/3 of the cases.
Yeah, request panelists not to post the answer in the chat box.
Yeah. This is for contestants to participate without looking at the chat box. Yeah, so I see only 5 people have given the correct answer. So if a girl is less than 15 years, but if the interval between the first and second dose is less than 5 months, then you have to give a 3rd dose. So the interval should be 6 months or more. Oh, Swan is catching up. Good. Uruj from Pakistan. Bhavya is keeping it. Wow, many right answers. Let's see. So this is the HPV vaccine consists of L1 protein into virus-like particles. So they are assembled. So they don't have the oncogenic virus, but they have the immunogenicity by virus-like particles. So Prith from India is still leading. Wow, almost everybody knew the right answer. So in HIV, the WHO recommends to start screening slightly earlier than in the general population. The general population, the age is 30. In HIV positive, it's 25 years. All right. So this is because the WHO is now recommending HPV DNA test as primary screening. So if somebody has got HPV negative and she doesn't have HIV, then the recommended interval is 5 to 10 years for repeat screening. So 10 people gave the right answer. Okay, so majority have given the right answer. Then the screen and treat approach, a positive primary screening test only is required, and then you treat them as soon as possible. Oh, Usman has taken the lead now. Good. All right, so majority had the right answer that in the screen, triage and treat approach, if your HPV test is positive, then you can triage them by doing either genotyping for specific HPV virus, colposcopy, or VIA or cytology. So all of the above is the right answer.
Okay, so please don't look at the chat box. The answers may be wrong sometimes.
Who is giving in the answers in the chat box?
Yes.
Few participants are giving answer in the chat box.
Please don't, but then the last answer was wrong.
We might be doing it purposely to confuse the... Wow. So majority of people are right that if you have HIV, in a patient with HIV, then the screening interval is less, 3 to 5 years only. Oh, now we have Dr. Shagun from India, and Prat is on the 3rd place. But India is like leading after Usman. Again, majority have the correct answer. It's type C radical hysterectomy, which is required. Again, majority know that for locally advanced disease, the modality of treatment should be concurrent platinum-based chemoradiation. Now we have another contestant from India catching up, Sony. Yes, again, majority of the contestants gave the right answer that laparoscopic radical hysterectomy is not the standard of care. So it's true, sometimes you have to give adjuvant radiotherapy after radical hysterectomy. Now again, the correct answer comes from majority. Operator nerve is the thickest nerve.
Our participants are expert in treatment portion.
Yes.
Yeah. And Usman has been steadily topping the list.
Yes, so radical hysterectomy can be performed by both incisions. That's great. So we all know that it's the 9 to 14 years age group, which is maximum, which gets maximum benefit by HPV vaccine. Wow, it's the first time again Pret is on the top. It's getting exciting now. Neck to neck competition. Again, majority knew the answer that WHO has set an incidence threshold of 4 per 100,000 or less if we are talking about elimination of cervical cancer from the world. Wow. Now it's India dominating. Wow, again, majority knew the answer. So 90, 70, 90. Can somebody raise their hand if they know what does 90, 70, 90 means? And maybe Sahiti can.
Shagun has raised her hand first.
All right. So whoever has raised their hand, can they be unmuted for the right answer?
Sahiti, please unmute Shagun. Shagun? Sahiti, are you there? Hello?
Yes, ma'am.
Yeah, please unmute Shagun.
Sure, ma'am. Am I audible?
Yes,
Yeah.
you are.
Yeah, so WHO cancer elimination strategy consists of the 90-70-90 rule. That means that 90% of females, young females by age of 15 years need to be vaccinated by 2 HPV doses. At least 70% of females who are in reproductive age group need to be screened for HPV cancer by a standard screening strategy at age of 35 and 45. And at least 90% of females who have been diagnosed with pre-invasive or invasive cervical cancer should be treated for the cervical cancer, and that also includes the palliative care therapy if they are in advanced stage of cervical cancer.
Great. Thank you, Shagun, for a complete answer.
Thank you, ma'am.
Oh, Shagun has already given the
There's still a
answer.
test that hope everyone has heard what happened.
So this was an easy question because Shagun had already given the right answer. So I'm glad that
Still
we all.
17 people did not hear what she has told.
Yeah, that's bad. It's okay. Yes, so WHO suggests stopping it at the age of 50 after 2 consecutive negative screening results, right? So whoever have given the wrong answers, this is the current WHO guidelines. So only 9 people gave the right answer, and so this one, which majority of you have selected, the teal ribbon, this is in the ribbon category, this is for ovarian cancer, and the cervical cancer has got on one side teal blue and on one side white. So this is the right answer. So second last question. we had equal number of right and wrong answers. So for people with HIV, the screen, triage, and treat is the option selected by WHO rather than screen and treat. We'll discuss it in the next round why it is so, but screen, triage, and treat is the right answer. We have majority right answer. Today we are celebrating 2nd anniversary of the launch of the cervical cancer elimination strategy by WHO. So that is the significance of today's quiz being held on November 17th. So I'm glad that majority of us knew the right answer. So let's look at the winners. Caroline is on number 3. Usman is on number 2. Okay, so I want to congratulate Prit from India, Caroline from India, and Usman from Pakistan for being the Kahoot quiz winners. And now,
but Alia, can we give them a chance to speak one word? At least we'll know from which part of India they are and Usman from which part.
Yeah,
and
sure.
what they're doing is.
Yeah.
Yeah, Saiti, please unmute Caroline, Pratt, and Usman.
Yes, ma'am.
So let Caroline speak first, followed by Usman and then Pratt.
And if you look at the numbers or the scorings, it's so close.
Yes, yes.
Prit was 19,000, Usman was 17,000, almost 18,000, Caroline was 17,000, and they had 23 out of 25 correct, 20 out of 25 correct. So that's commendable. I'm so proud of
there
all
are
of them.
people in the chat box asking for the Kahoot pin, but I think we are very sorry that we have already finished the game. So I think you are a bit late for that. So maybe we wish you best of luck for the next round when we plan again.
Yeah.
So Caroline, can you speak up?
Good evening, ma'am.
Yeah.
I am Carolyn. I am doing my first year MCH. I'm a first year MCH Gynae trainee in All India Institute of Medical Sciences, New Delhi.
Okay, Caroline. Okay.
Okay, good.
And Usman?
Hello everyone, good evening. I am Dr. Usman. I am working as a fellow in Gynae Oncology in Aga Khan University Hospital, Karachi.
Okay, great. And Pratt?
Hello.
Yeah.
I'm Dr. Pratima, ma'am. Hello.
Okay, Pratima.
Pratima from Delhi, Delhi RGCRC, doing my residency in Gynae Oncology.
So you are with Dr. Rupinder?
Yes, ma'am.
Okay then. Congratulations, many congratulations.
So congratulations, Prit, Usman, and Caroline. The exciting prizes for the Kahoot winners will be announced later. So now I will share the rank list so that we can decide. So we have one team from India based on this Kahoot, one from Pakistan, and we have to see in the rank board which 2 other countries have been on the top. So then we can request them to join our second round. The rest of the participants can stay there and observe the second round because it's full of knowledge and full of interesting cases. So I'll stop sharing this podium and I have to.
Yeah, so madam will show you the list of winners in the order, and then you can choose your partner whom you want and share your WhatsApp numbers and you can team up because in Jeopardy we don't have any time limit. So you can take your time, discuss and give the answer. And those who have not been able to play or join, don't be disheartened. So now that all of you are aware about how we are playing the game online, so better luck next time. We'll be back soon with some other topic, if not cervical cancer, some other topic. So we will have you again with us very soon.
So I'll show you the rank list. So we have Priti from India, Usman, Carolyn from India. Then we have Ati from India, Shagun from India, Priya from India. So they are all from India. Let's see if we have. Then we have Asma Ali from Pakistan. So maybe Asma Ali can join Usman. Then we have this Upend.
Uppa India, I think. It's Uppa India.
Uppa India, okay. Then we have Bhavana. Bhavana is also
I think must be from India only.
Okay, so let's see. Oh, we have one from Sri Lanka, Shammi.
Shammi. Malindu, you are from which country? Yeah. Please unmute Malindu, yes. Malindu, you are from which country? Hello? Malindu, are you there? Saiti, can you unmute Malindu?
Oh, Malindu can write in the chat box.
Yeah. Malindu, please write you are from which country?
So we have one team from India, one team from Pakistan, and I saw one name from Sri Lanka, Shami. Shami, are you there? Can you raise your hand? Bhagya, can you keep a thing?
Yeah, just doing. No one has raised hand yet.
I don't know what happened. What about this Naila and Zabes? Are they from any other country other than Pakistan and India?
Only hope they have not left the game. Not left the webinar.
We have another from Sri Lanka, Chalitha.
Naila is from Pakistan. She has written.
Yeah.
So I think we can go ahead with two teams, one from India and one from Pakistan.
Okay. No, but what about Sri Lanka? We have.
Yeah, Sri Lanka, we have one person.
We have.
Anyone from Sri Lanka, please write in the chat box.
Vishnavi and we have Chalita. We have
three people from Sri Lanka, yes.
Yeah,
Chalita so Sri Lanka, she has already written it. Yes.
Yeah. So
who else from Sri Lanka? Kindly write in the chat box. Anshu is from India.
So, Usman, you are welcome to make your team among the Pakistani contestants, whoever you wish to. And you can, in the chat box, you can connect with them or get their WhatsApp number, whatever, for communication. So you have Masuma, who is also a winner from Pakistan. You have Asma Ali, who's from Pakistan. You have Nimra, and then we invite Prita to make her team. So Prita, do you have Pratima, do you have any contestants you want to join you as a team?
Anyone is anything is from Caroline and Priya if they're ready, or Caroline or Shagun if they're ready.
I am ready, Dr. Pratima.
Okay.
It is Dr. Caroline
and Dr. Ati. Who is Dr.
Yes,
Ati?
yes.
Yeah. Okay. Fine.
Okay.
Okay, so India team is ready. One is Pratima, Caroline, and 80. 80, what is her full name? 80? Apurva. Right? It's Apurva Tak, I think.
Usman, who will be in your team? Can we unmute Usman so we know who is going to be in his team?
Yes, ma'am.
So Dr. Alia, they can take more than 3 members also, no, in the team?
Yes.
Okay. Okay.
Or maybe Bhagya, if we have only people from India, so then what was her name? Pritima can make one team, and the second contestant
Caroline can make one team.
one team. So we'll have at least
that'll
3
be more
teams.
better.
Yeah, so
that's more interesting. Pratima, you make your team, and Caroline, you make your team. Okay.
Yes, ma'am.
And how much time you would like to form teams? 5 minutes?
Ma'am, they can write in chat box, ma'am, their team members, so that it will be good.
Please write. Please write in team.
Mohammad Usman has written he wants Atia as the team, and who else, Usman?
Dr. Kinza from Pakistan.
Kinza.
And Asma Ali. So Usman has 3 team members, Asma Ali and Atia as the team members, and Pritima has Priya, 80. What is
80 is Apurva, I believe.
Apurva Tak.
Apurva Tak, yeah.
And Pritima and Priya. So this is the second team. And Caroline, can you make your team and write in the chat box?
Bhagyalakshmi, ma'am, with your permission, I will make the team members as panelists so that they can turn on their video.
Yeah. Please make the panelists. Yes.
Okay, ma'am.
So Caroline, do you have team members? Ravisha
from Pakistan, she's also. So I think we didn't see her name in the list of people who had played the game.
Yeah. So if you are ready, can I share the screen of the next round? I think we should, because
Caroline, be fast.
Ma'am, 1 minute, ma'am. I'm making them as panelist.
Okay, but Caroline has not shared her team members yet. Caroline, can you hear me? So we need 4 teams, right?
No, I'll reduce the number of the teams because we don't have.
Yeah, I think Caroline has taken Shagun. And, take one more member also.
Hello. And then type
Ma'am, Usman team member is only one, ma'am. Only Asma Ali is there, and any other else? Atia. Okay.
Caroline, take one more person with you.
Are we done? Somebody has raised their hand. Bhagya, can you please check?
Yeah, so this Dr. Angeline Emmanuel. So she has requested, can I be a part of the team if no one else is there? So Caroline, you can take.
Ma'am, we've already mentioned the team members, I think. Ma'am has mentioned the chat box.
Okay, then. Okay.
So sorry.
So can you finalize for us to be clear who are the team members from each of the team?
Ma'am.
So let me name the team. So Priya, who was
Pratima is team 1.
Pratima is team 1. Pratima, who is in your team?
My team, Dr. Apurva Tak and Priya.
Okay. Team 2 will be Usman. Usman, who is in your team?
My team consists of me, Dr. Asma Ali, and Dr. Atia.
Okay. And team 3 is Carolyn. So
Yes,
Carolyn,
ma'am. My team members are me, Shagun, and Vartika.
okay. So let me tell you how this game will be played. So this is a Jeopardy board game. You can see that there are some headings or titles for this particular line or particular column. So this is for screening protocol, HPV vaccine, VIA, CIN1, CIN2, and 3. Now these are the scores. So we'll start from team 1, and team 1 can say that we select this, for example. I'll open this question and team 1 will try to answer it. Now, if they have selected 200, they'll get 200 marks for a correct answer. And if they give an answer which the other teams feel is not correct, that other teams can say we want to challenge them. So if they challenge them and they give the right answer, they'll get the 200 marks. And the team who has given the wrong answer will get minus 200, right? So this is a game of tough decisions. And for this game, the quiz master is Bhagya Lakshmi. And this is so that if there is any contention about the right answer, the Bhagya Lakshmi will have the final say that this is, in her opinion, the right answer. Okay. So we'll start from team 1.
I request all the attendees to make sure that their team members are there in panelists or not.
Yeah, ma'am, just stop them once.
Usman, there is no time limit for this. And number 2, please check that your team members are all panelists and not in the delegate, so that all will be able to speak. Yes, Pratima, please go ahead and tell what you want to say.
Ma'am, how, I mean, I don't know, like how we are supposed to discuss and tell the answers.
You have to connect by WhatsApp.
WhatsApp, okay.
Yeah, so you can take numbers of your team members. So we are giving you a few minutes to do that.
Okay, ma'am.
Yeah, you make a WhatsApp group, okay? 3 of you make one WhatsApp group, and in that you can discuss.
Yeah, because if you discuss in the chat box, then the other teams will know what you are discussing and they'll cheat. So try to keep it secret.
Yeah, Usman and Caroline, make WhatsApp groups with your 2 other teammates. Right?
Yes, ma'am. Yes, ma'am.
Yes.
And you have to be very, very careful in your selection of questions. And if you want to challenge, because there is negative marking, but this is an interesting round and you'll get, there are some easy questions. So it's all your luck. And it doesn't matter if you select 500, it's not going to be the most difficult questions. These are just random questions. So Bhagya, when will we know that they are ready?
Yeah, please raise hands when you are ready. And I think we'll give them 2 more minutes. Yeah, 2 participants have already raised. Yeah, 3 teams only. Yes.
Okay, so can we now request team 1, Pratima, to select which question they want to ask?
Dr. Alia, as I understand, they can pick up from anything, no? Screening protocol, HPV, VIA.
Yeah. They can select from anything, any number.
So if you are very confident on screening protocol, you can pick up 500. Okay.
Yeah. And the thing is, and all questions are from WHO guidelines. They're not from anywhere else. And secondly, we have to give them some timeline for each question. So
okay, so how much still?
We can put a timer for each question once they've selected.
Yeah. So Saiti, can you help us with the timer?
Sure, ma'am.
So once they've selected and we say timer on, then we'll give them, what would you say?
2 minutes should be fine. 2 minutes.
2 minutes. Yeah.
Discuss, I think 2 minutes.
Yeah, 2 minutes is the.
Okay, ma'am. I will announce
after selection. We give you 2 minutes. Yes.
Okay.
And no prompting, please, because many of you are panelists, so don't prompt.
Yeah, and the participants who are observing should not write in the chat box. They should just keep it in their heart because we want a good competition. So Pratima, can you select the first question? Pratima?
Hello, yes, ma'am.
So which question you want to start with?
Ma'am, anything is fine. I don't know.
No, you have to select.
Okay, screening protocol.
Dr.
Which
Alia,
one?
can they click or they will only have to tell?
They have to tell and I will click.
Okay, okay. Some from screening protocol, which one?
Which one, ma'am? I mean, among that 100, 200, 300, that?
It's according to the marks that you'll get if you answer the question. So 100 is supposed to be a very easy one, 200 is little difficult. And so if you are very confident, you choose the 500 one. If you are not very confident, you choose the 100 one, whatever you wish.
400.
Okay, great.
Okay. I have started the timer.
Yeah, start the timer.
Start the time. The question is, in screen and treat approach, which two screening tests are used?
VIA and HPV.
Okay, the other teams, do you want to challenge her?
Yes,
Who wants to challenge?
I'm Usman.
Are you
Usman
understand
came
that
too.
if you challenge and if you give the wrong answer, then you will get minus 400?
No.
We have negative. So we
So Usman is saying that he wants to challenge. Pratima is given the answer that the two screening tests are HPV and VIA. Usman, you want to challenge? Usman?
Yes, ma'am.
Okay, then if you want to challenge, then give the answer.
Sorry, wait 1 minute, 1 minute.
Everybody gets chickened out when they hear the negative marking thing.
Yeah, and Saiti, do we have the timer on somewhere?
Yes, ma'am. It's 1 minute 30 seconds, ma'am.
Okay, okay.
30
Because you are
seconds
looking
more.
at it. Okay.
No,
okay.
ma'am, I don't want to challenge. मैं statement सही नहीं पढ़ पाया था. Sorry.
Okay.
Okay.
So I'll give the right answer. Wow.
So team 1 gets 400 marks. Yes. Okay. So Apurva, you have some problem? Why you are raising hand?
yes, ma'am. Yeah, one second. Good evening, ma'am. Ma'am, I just want to ask that there are negative marking. Ma'am, actually, we were not able to, I was not able to hear when we were making the group. Ma'am, we have negative marking and we have to discuss through the WhatsApp group.
Yeah, you have to discuss among yourself if you
And
are
speed
finding
of
it difficult.
answering, ma'am?
Yeah, after the question is displayed, we give you 2 minutes. Okay.
Okay, ma'am. Okay, thank you, ma'am.
Okay. Yeah, next question to team 2.
Usman, you have to select
please,
the question.
I'll play for screening protocol for 500.
Your time starts now.
Usman, hurry up.
Usman. If you don't give it, you'll get negative marking anyway.
Osman, Athiya, Asma, anyone?
1 minute over, 1 minute more.
Oh, the 1 minute goes very slow.
No, there's still 1 more minute left, but start thinking fast.
3 times.
Okay, anybody wants to challenge, Usman?
Caroline, Pratima, you want to challenge him or he is giving the correct answer?
Last 10 seconds.
If we answer there is a negative marking.
Yes, if you challenge, then there is a negative marking.
I mean complete marks.
Yeah, if you give the correct answer, then if you think
6 times
it's wrong,
Time
then
up, ma'am.
challenge.
Ma'am, shall I?
Time up.
6%.
Who has given this answer?
Pratima.
Okay, let's see.
What they have taken our answer or not?
Okay, the answer was not shown, Dr. Alia.
Yeah, I'm trying to see.
Yeah. Okay. So it's 6 times. Actually, in fact, Pratima is also not very correct that 6%. The risk is 6 times. So
Okay.
Usman gets negative 500 and Pratima, I don't know, it's 6, but she knows that it's riskier, but then she has not been able to give the correct figure. But can we give her some marks?
I don't know. If she said 6%, then that's not the right answer.
Yes, it's 6 times. Okay.
Yeah. So this time, this is the first time, so I'll not give negative marking, but be careful when you are giving a challenge answer, then you can have negative marking as well. Okay.
Right.
Okay, now team 3, Carolyn. Which question
Ma'am,
you want?
yes, ma'am. We will choose from HPV vaccine and 300 points.
Your time starts now.
Shall we answer, ma'am?
Yes.
Yeah.
Sure.
So if the primary screening with HPV DNA is negative, we shall follow the patient in 5 to 10 years.
Okay. Anybody wants to challenge team 3? No? Okay,
No,
let me reveal. All right. So your answer was partly correct, but was not incorrect. So you have HPV negative with in general population, your answer was correct, 5 to 10 years. But the correct answer should have been 3 to 5 years for women with HIV.
Ma'am, that was an
But-
MCQ as well. So like we answered that.
Yeah, I know. So we'll give you 300 marks.
Thank you, ma'am.
Okay, now we back to team 1. Pritima?
HPV vaccine.
Okay. 400. Okay.
Acha, 400.
Okay.
Your time starts now.
One, 2, 6.
Hello.
No,
Yes,
no, no.
ma'am. It is. Hello. It is 3 vaccines, 3 doses at 0, 2, 6 with Gardasil and 0, 1, 6 with Cervarix.
Okay. Anybody wants to challenge Pratima?
And even with nanovalent also it's same. 0, 2, 6.
Okay. So 0.
One, Caroline, you want to challenge her?
No, ma'am.
Usman, you want to challenge
No,
her?
ma'am.
So the answer was correct. 0 to 6. This was team 1.
Yes.
And what was the question? 400?
400, yes. So they
it
get
is-
800.
They are 800. Okay, Usman, your turn.
Ma'am, VIA 400.
Your time starts now.
Usman, come on, hurry up.
Ma'am, can the other team answer?
No, no.
No.
Okay.
We have to give them 2 minutes, and then if they can't answer, then you can challenge.
Okay.
1 minute over.
Usman. Fuck up. That is the disadvantage of VIA.
What about the other team members? What are they doing?
Ma'am, up to menopause, we can use VIA.
Yeah, but
we want
WHO
to
has
try.
put a age.
What did she answer, ma'am? Did she give any answer?
He said up till the age of menopause.
Ma'am, can we take the question?
Shall
So up to the age of menopause, because after menopause, the transformation zone is not completely visualized and the VIA would not be acceptable tool for screening.
So in principle, you're giving the right answer, but what age is recommended
Time
in
up, ma'am.
WHO
Ma'am,
guideline?
can we answer?
Ma'am, shall we answer?
For 50 years.
Oh, yes. Okay. So now do you want to challenge Pritima and Carolyn?
No, ma'am.
Okay. Let's see. So you gave the right answer that in women more than 50 years, it should not be used because once menopause occurs, the transformation zone recedes into the endocervical canal and prevents it from being fully visible. So that's the question. So now team 2 is 2 minus 100.
Minus 100? Okay.
Minus 100. They were minus 500. They gave a 400 answer. So they are now minus 100. So now team 3, Carolyn.
Choose your
Yes, we will take vaccine 500.
Okay.
Your time starts now.
Can the contestants have their cameras open so we can see their faces as well? It will be more interesting.
So when
Yes. Is Carolyn given the answer?
Yes, ma'am.
Yes.
Yes.
Correct.
1 minute over.
Time இருக்கு.
Should we take?
First, let's decide on the answer.
We'll give them 2 minutes to answer. Pratima.
Okay, ma'am.
Last 30 seconds.
Yes, ma'am. So when the HPV is positive and VIA is also positive, The next option can be colpo plus minus biopsy. But since considering her age is 27, there is another one more option available. Like we can follow her with code testing after 1 year also.
So can you say it again, all the answers?
There are two options available. One is like, since both are positive, directly go for a colpo plus minus biopsy, colposcopy plus minus biopsy.
Yes.
But 27 years, because HPV is positive, because less than 30 years, there can be transient infection of HPV. So there is the second option is we can keep her on follow-up and with a co-testing after 1 year also.
Okay. So do we have any challenges? This was team 3 giving a 500 question. They're going to lead after this. So do we have any challenges from team 1 and team 2? If not, then I will reveal the answer.
Ma'am.
No, beta, you were late. So the correct answers given are colposcopic biopsy followed by treatment based on biopsy report. This was the answer you gave. Colposcopy followed by NETs at the same visit if high-grade lesions are suspected, and cryotherapy at the same visit, right? What you have to understand is that in this patient, VIA is also positive. So in these kind of situations, you have to treat. You can't observe. You have to do a colposcopic guided biopsy, and then based on biopsy report, you can observe if it is just CIN1. But if you say that we will not do colposcopy and that just observe, then that option is incorrect. What do you think, Bhagya?
Yes.
Yeah, because
WHO has given a guideline like 30 years, but there are other trials which have also shown that after 25 years also there are some countries which are telling that we can do a HPV test. So since it's both are positive, I think she will need some treatment.
Yeah, so as a quiz master, Bhagya, now you have to decide whether it is the right answer.
Ma'am, my first option was colpo plus minus biopsy.
Yeah, I know. So the quiz master has to decide whether to give you marks or not give you marks.
Okay. Okay.
So please repeat your answer again, Caroline. Dr. Alia, she told we'll do colposcopy guided biopsy. So this is the one part and which was correct.
Yeah.
But then she has never told that we will treat based on the biopsy report, right?
Yeah.
So it's quite an incomplete answer. I wish I had some, if from 500 we could give 250 marks. Anyway. So I think we shouldn't give any marks because the one line which she has told among the three, one is only incomplete. If she would have told at least treatment, I think we could have given her that we need to treat.
Yeah. So what do you think? We should give negative marking or just not give marks?
Just not give any marks.
Good evening, ma'am.
Okay.
Yeah, Shagun, what do you want to say?
Actually, ma'am, I just had a doubt, like in the flowcharts mentioned in the WHO, they usually, like the next step is usually colposcopy, and then based on the biopsy, the next step would be based if the lesion is adequate for ablation or excision, and then all those steps come for management.
Yeah, treatment.
Yes, ma'am.
Treatment. She only told colposcopy and biopsy, and she stopped there. So that's the issue actually.
Okay, ma'am.
Okay,
so we don't give it any negative.
Ma'am, good evening, ma'am. This is Vartika, ma'am. Hello.
Yeah.
Yes.
Ma'am, we said colpo plus biopsy because based on the findings of colpo only we can decide that how will we plan her treatment, whether she is a candidate for LEDs in the same sitting or for cryo in the same sitting or not. Depends on transformation zone as well.
But you didn't say it. That's what we are questioning. That maybe you understand, but you didn't say it. If you would have said it, you would have had full marks. Just because you said the first part, we are not giving you negative marking, but we can't give you full marks for it. So we are sorry. The quiz master has decided, so no challenges.
Okay,
can we go back to Pratima? Pratima, now your turn.
Ma'am, via 500.
Via 500.
Your time starts now.
Usman, there are 3 types of transformation zone. Type 1 is which is completely ectocervix. The squamous collar junction and the transformation zone is visible, and the type 2 is also visible, but then if it is going up to the endocervix and it is the squamous columnar junction and transformation zone, type 2 it is visible. But in type 3, the squamous columnar junction is going into the endocervix and it is not visible. So these are the type 1, type 2, type 3 transformation.
What is not visible?
About squamous columnar junction, the proximal.
Transformation zone.
Okay, anyone wants to challenge?
In type 2.
Anybody wants to challenge?
Yes, actually it is a transformation zone. Type 1 is we see the transformation zone fully visible. Type 2 is transformation zone seen but with some manipulation. Type 3 is transformation zone not at all. Even with manipulation, transformation zone is not seen.
Caroline, Usman, you want to challenge her? Caroline, is it the transformation zone or something?
Yes, ma'am, I want to challenge.
Yeah, tell me.
The transformation zone is also visible, but the squamocolumnar junction is not visible. In a type 3 transformation zone, the transformation zone is visible, but the squamocolumnar junction is in the endocervical canal. So that is not visible. The transformation zone is visible.
Okay. So I think Dr. Alia, you show the answer and then we'll decide who is the correct one.
I think team 1 gave the right answer. So you have 3 types. One is in which the entire transformation zone is visible. Usman, to correct you, the transformation zone comprises of squamocolumnar junction. So you can't divide the two, right? And in the type 1, it is entirely visible and only ectocervical. In the type 2, it is entirely visible and has an endocervical component. Type 3, in which it is into the endocervical canal and is not fully visible. So I think team 1 gave the right answer.
Yeah.
So was it a 500 marks?
Yes,
so
yes,
yes.
yes.
To 1300. Okay, team 2. Usman, you have to select a question.
We'll play for scene 1, 400.
Your time starts now.
Yes, Usman. And the team. Do you understand the question? The other 2 teams should get ready for challenging.
1 minute over. Last 30 seconds.
Usman. Come on.
Yes, ma'am. Double freeze technique use करनी चाहिए.
Okay. Anybody wants to challenge him? No? All right. So that's the right answer. Double freeze using a 3-minute freeze, 5-minute thaw, and then 3-minute freeze cycle. So that's the optimum type of cryotherapy for treating CIN1. So Usman will be now 300. team 2 will be 300. And
Yeah,
now,
he has taken okay, it was a 400 question. Okay.
yeah. So now see team 3, Carolyn.
Yes, ma'am. We will take from CIN 2, 3, 400.
Your time starts now.
The participants, if they have any questions, they can write in the chat box and we'll try to answer them. We can't let you speak now because the quiz is going on. Carolyn and team.
One minute over.
Come on, Carolyn.
Yes, ma'am. One is the normal cone, coal knife conization. The other type is a cylindrical cone and the top hat cone.
The other two teams, do you want to challenge her?
Can she repeat the answer?
Yes, Carolyn, can you repeat the answers?
The normal cone, which is the coal knife conization, normal one. The second one is the cylindrical cone. Third one is the top hat cone.
Anybody wants to challenge? This was a 400 question, 400 marks.
Ma'am, hello, good evening.
Yes.
Ma'am, Caroline ma'am wanted to
I want
add
to challenge.
leap in that. Hello.
Yeah.
Hello.
Yeah. You can give the answer. You are still
I want to challenge the answer.
okay. Usman, you can give the answer.
The one is the coal knife conization, and the other one is the conization using the laser, and the third one is the loop or the LETS procedure.
Okay, now let's look at the thing. So there are three types of cone biopsies. One is the cold knife cone, everybody knows. One is the LETS cone, and third is the laser cone. So Usman has given the right answer. So Usman will get the 400 marks and will go up to 700, and team 3 will be minus 400, 300. So it will be minus 100. No worries. We have still questions to go. Now it's time for team 1.
CIN 2 500.
Your time starts now.
This is a management question. What will you do if you have this scenario?
Ma'am, okay. If it is colposcopy suggestive of CIN 2 and if it asks H, so we'll have to again repeat after 6 months and 6 months. If it is anytime, if it is persistent for more than 2 times, then again we'll have to do a colposcopy. If it is more than CIN2, or if it is colposcopy, if it is more than CIN2, then we'll have to, or cytology is more than as plus, then again we'll have to do a biopsy.
Beta, we can't hear you properly. There was a lot of disturbance. Can you say it again?
Please repeat it again.
Ma'am, since she's 19-year-old, sorry, 19-year-old sexually. Okay. So if
Again, there is a lot of noise.
Beta,
Please
can you
log
write
in
down
from one device only, or else echo will be coming.
Okay.
I think the echo is because she is joined from 2 devices.
Okay, ma'am. A 19-year-old sexually active at age 15. So as sketch and colposcopy suggestive of CIN2. So she has, she has to be followed up for 6 again after 6. She has to be done the colposcopy, or should be done after 6 months, and again further 6 months. So if anytime if there is persistence of the same lesion, or if it is progressive, then we'll have to go for a treatment. If it is not, then again we'll have to repeat the test for again 1 year. 6 months and 6 months. If it is fine, there is everything is negative, then she can go for a normal routine screening. Otherwise,
okay. The other team, this was team 1, wasn't it, Pratima? Was it you? Okay.
Yes, ma'am.
So team 2 and team 3, do you want to challenge her?
Ma'am, I am unable to hear her answer.
So the answer was that you are going to observe, repeat colposcopy in 6 months, and then in another 6 months. And if it is persistent for, from what I gathered, a year or more than that, then only you go for treatment.
I would like to challenge, ma'am. Actually, we have to repeat it 6 monthly up to 2 years. At the end of 2 years, if the disease is persistent, then we may have to go for the treatment at the end of 2 years.
Who said this?
Carolyn, team 3.
Carol. Okay, let me reveal the answer. So Carolyn's answer is correct, that for CIN2 in an adolescent girl, observation is preferred as long as colp is satisfactory. Colposcopy and cytology at 6 months interval for up to 2 years. Treat only if CIN2 persists for 2 years, because she is adolescent and you don't want to overtreat a transient lesion which might disappear. So Carolyn gave the completely correct answer, although Pratima's answer was not incorrect, but she was not able to say that we have to wait for 2 years, considering she is adolescent. So Bhagya, now ball is in your court. Which team should be given the marks?
I think Carolyn's team has to be given the mark.
Okay, so they were minus 100 and this was a 500 question. So they will go up to, they'll go to 400. And team 1 gave the incorrect answer. So they will have minus 500. So they'll go to 800. No worries. You are still leading. Team 2, Usman.
Ma'am, we'll go for the screening protocol 300.
Your time starts now.
Usman.
Yeah, he still has 1 more minute to go.
Oh, looks like ages.
Ma'am,
But
इसमें जो हम decision लेंगे, it should be based on the positive primary screening test. तो इसके बाद हम follow करेंगे उसको triage पे, तो उसको मिला के फिर हम उसका एक decision लेंगे.
So that's what it is saying. You have to understand the question. The decision to treat is based on which? The primary screening test or the triage test?
Ma'am, both.
The other teams want to challenge them?
Yes, ma'am. Both the treatment decision to treat is based on both screen positive and triage positive result, with or without the HPV histopathological diagnosis.
This was Caroline?
Yes, team 3, yes, ma'am.
Okay, let me reveal the answer and let's see. So a positive primary screening test followed by a positive second test, which is a triage test with or without histologically confirmed diagnosis. The decision making is this. You understand, Usman, where you were wrong? So the decision is not on the screen only. It is based on the triage test being positive, and then you have to confirm it on histologically.
You may not confirm with or without histology.
With or without, yes. And then you have to make a decision.
It's the triage result. If you have a screen positive, then the triage result will decide about the diagnosis.
So
Ma'am,
I
the
think
next participants was saying that it should be done on histologically. So I think
No,
the
she told
without.
without histology.
Ma'am said without histology.
Okay.
so. They get 700 and team 2 gets minus 300. So they go up to 400. Okay, now it's Caroline's team turn to select the question.
So we will go CIN 1 300.
What? CIN 1 300.
CIN 1 300.
Time starts now.
Okay.
How much time do you have?
1 minute over, ma'am.
Okay. Thank you, Saiti, for keeping us on track.
No, this is Caroline's team to answer, not Pratima. Pratima, please mute yourself.
Yes, ma'am.
Yes, ma'am.
Only LCIL, I think it is close to 6%. If LCIL in the background of HPV positive, sorry,
So you have to give a range, yeah.
Yeah, it is in the with HPV positive, it is like 5 to 6%. 6%. I would take it 6%. And HPV negative is like less than 1%, 0.5%.
Okay. Anyone challenge Caroline, Usman, and Pratima?
Ma'am,
yes.
Ma'am, we could not hear.
So this is the question. She has told that if it is HPV positive, it's some percent, and it is HPV negative. If it is HPV positive, it is around 5 to 6%.
Time up, ma'am.
Okay.
Ma'am, I had told the other way. HPV positive is close to 6%, and HPV.
No, that only I told. Yes, that only I told.
Okay.
So anybody wants to challenge?
Ma'am, can I? Ma'am, if I'm not wrong, what has she said? If it is only on the basis of LCIL, the percentage of CIN2, she has said how much, ma'am?
Point something.
0.5.
And ma'am, CIN3?
No, they have
2 and 3 together.
Yeah.
What?
So it's a range, right? If it's HPV negative, it's something. If it's HPV positive, it's something. You want to challenge? Or we go to the answer?
So the answer is 15 to 20%.
Hello.
Hello.
Okay. So I think Caroline
Yeah.
gets negative and no one challenged her.
Okay, so she goes to 400. Okay, team 1 now.
We will take
We can't hear you.
Pratima is not speaking. Pratima, you want to take which question?
I think she's
ma'am, screening 200.
Okay.
Your time starts now.
Please unmute. Please mute, sorry.
One minute over.
This is Pratima, isn't it?
Yes.
It is based on the positive of the test, irrespective of the histology or triage. It is directly based on the positivity of the test, the treatment.
Okay. Anybody wants to challenge?
I think it's only screen positive here. It doesn't, histopathology doesn't come to play at all. Only screen positive.
Yes, ma'am.
And then we have to treat.
Yeah, she has to.
Dr. Pratima, I request you to please log in from one device.
All right, so the correct answer was a positive primary screening test only. And now this was for 200, so they go up to
1,000. Okay, team 2, Usman, get ready.
Usman, question?
HPV vaccine 200.
Your time starts now.
How many types? Matlab?
Apurva, mute.
Please keep yourself muted. Only the team which is going to answer should keep them unmuted.
There are 3 types of HPV vaccines. One is the Cervarix, which is protective against HPV 16 and 18, and then Gardasil 4, which is protective against 6, 11, 16, and 18, and then Gardasil 9, which is the nanovalent.
Anybody wants to challenge? No? Osman gave the right answer.
Yeah, full marks.
Bivalent, quadrivalent, and nonavalent.
Yes.
Good. So they go up to 600. All right.
Caroline?
Team 3.
Yes, ma'am. We will take via 300.
Your time starts now. 1 minute over.
This is Carolyn's team?
Yeah.
Yeah. It's not a very difficult question. Come on, Carolyn. Can we have all the contestants open their camera, like the ones who are participating in the Jeopardy, so I can have a screenshot?
Ma'am, can
Last
we
30
answer?
seconds.
Ma'am, if a patient is via positive and she undergoes a treatment, then a repeat screening should be done at 1 year, after 1 year of the treatment.
Okay. Anybody wants to challenge this question? Challenge this answer? No?
Ma'am, I want to add something.
No, you are too
तो
late.
यही है, लेकिन I want to add, if the patient is HIV positive, then the screening should include a repeat test after 1 year and the second test after 1 year.
Okay.
Okay.
But the question didn't include VIA,
Yes,
so
okay.
I will take this as the correct answer. But thank you, Usman, for adding this.
Thank you, ma'am.
All right, now we go to team 1, who's the leading team. Pratima.
Ma'am, CIN 23200.
Your time starts now.
Okay. Biopsy लेनी है ना? हाँ, biopsy लेनी है because it looks like there is a growth and there is bleeding also.
We heard all the answers. It's okay.
Ma'am, postmenopausal bleeding, there is a bleeding seen and there is a growth seen there, so visible. So we'll have to take a biopsy. There is a visible growth.
I'm not sure. So anybody wants to challenge this team?
Ma'am, examination under anesthesia and biopsy.
Are you challenging them? Because you will get negative marking.
Yes, ma'am.
Okay, let's see the answer.
Biopsy.
So they gave the correct answer, Usman. I am not disagreeing with you that she has to have an EUA, but first you have to confirm the diagnosis by a biopsy before you embark her on a clinical staging. Bhagya, what do you think?
Ma'am, you are on mute.
Ma'am, my point would be that the cervical carcinoma usually bleed to touch, so it would be prudent to take a biopsy in an operation room rather than in a clinic setting.
Usman, I think in our LMICs in low resource settings, we cannot wait for 8 days for a patient to take her to the OT and take a biopsy. It's not brutal because most of the time it won't bleed, and if in any case it bleeds, you can always give some tranexamic acid or a little tight pack and that will take care of itself. So I think don't waste time. When you see a growth like this, it's not necessary to waste time to take her to the OT and doing the biopsy under anesthesia.
I hope I don't get negative marking on this one.
Well, we'll not give
forget about that. Let's not give any negative marks, but then I think this is a very important thing that everyone should take home this message that it's not necessary, because we see people doing this, keep the patient, work her up, that takes around 10-15 days, then they'll take her to OT and then take a biopsy and do exam analysis. So we'll lose a lot of time unnecessarily.
And
do the biopsy and then work her up, and in case your clinical diagnosis doesn't match or something, then you can always do a UA.
And
or patient is not cooperative. That sometimes very rarely that also does happen.
Yeah. And Bhagya, also sometimes patients disappear. They will not come back. So that's why it's more prudent to do the diagnosis then and there. We are talking about LMIC. We are talking about WHO guidelines. So now team 3. No. Team
Team
2,
two.
Usman's team. Yes.
So I would take seat 2 and 3, 300.
Your time starts now.
Some attendees have raised their hands. Beta, can you write in the chat box what's your question? We can't unmute you right now. We have to wait for the quiz to finish and then we'll be able to answer your queries.
Yeah, please write it in the chat box. Okay, so this question is for Caroline?
No, this is for Usman's team.
1 minute over.
The risk is roughly 1 to 2%. Sorry. The risk is around about 70% of having seen 2 and 3 cervical biopsy.
Anybody wants to challenge Usman?
It is around 70%.
Okay, it seems like nobody wants to challenge. So,
Ma'am, I want to challenge.
Oh, you are a bit late. So his answer was correct. It was 70 to 75%. So they get 300 marks and they go up to 900. Now it's time for the team 3. We just have few questions left, so let's hurry up. There is 500. Nobody is brave enough to take it.
So we will take SIN 500.
Okay.
Your time starts now.
Yeah, fast.
The lesion should be totally ectocervical, and it should be the transformation zone should be totally visible, and there should be no endocervical extension, and two quadrants should be involved. Not more than the lesion should be occupying 75% of the cervix, and no glandular endocervical component should be there.
Anybody wants to challenge team 3?
Ma'am, I will challenge.
Ma'am, we are still to say in this, there should not be any suspicion of cancer. Full extent of lesion should be visible. There should not be any current infection. Patient should not be pregnant at that time.
Okay, now who wants to challenge
Ma'am,
them?
I will challenge.
Who is this?
Pratima, ma'am.
Okay.
Ma'am, eligibility for ablative criteria is lesion should be first of all entirely visible, and it should not be more than 2 quadrants of the cervix. And the next is the lesion should be located completely on ectocervix, and there should not be any endocervical or vaginal extension. And then it should by the cryotherapy or probe, whatever it is available, so the lesion should be covered by the largest whatever is available, and then there should be no suspicious of any invasive cancers. And then basically most it is contraindicated in pregnancy or and then postcoital or
We
post
said the same thing.
Fatima, we are
We
not
said the
asking
same thing.
contraindications. We are asking about eligibility.
We have mentioned same thing.
We have mentioned the same thing.
I agree. I think Pratima has not given anything different from the first answer. What do you think, Bhagya?
Yeah.
Ma'am, but then they should not be postmenopausal. It is also eligibility criteria, no? If they should not be postmenopausal or they should not be postcoital. they should not be having. So this is
Ma'am, in the WHO criteria for ablative treatment, there are like 4 specific lines which are written. So I think,
and there should not be any obvious cervical growth or
I'll show you
irregular.
the answer. This is the WHO answer. No suspicion of invasive cancer, which you have said. Transformation zone is fully visible and the whole lesion is visible and it does not extend into the endocervix. The lesion is in the type 1 transformation zone. So I think that team 3 did give the right answer. What do you think, Bhagya?
Yeah.
Okay.
So we have not asked anything about contraindications, right?
Okay. So now there is a tie between team 1 and team 3. So let's have team 1 now.
Only easy questions left now.
Yeah.
Fast.
Now
So
we'll
let's
give
finish off the 200 ones and then let
we'll
the
give
100
1
ones.
minute each now. We'll not give 2 minutes now.
Yeah, it's easy questions.
Come on, Pritima.
Pratima, fast.
Why 200? Why 200?
Choose a question you are taking.
Your time starts now.
Yes.
So this is a 40-year-old with history of intermenstrual and postcoital bleeding. Look at the cervix after application of acetic acid. So this is a VIA. So what's your diagnosis?
Thirty seconds over.
Sahiti, have you cancelled all the cameras because I can't even see myself now?
I can see you, Dr. Alia.
Oh, I don't know what's happening with my...
But now again your camera is off.
Last 5 seconds.
Now I can.
Now it's on. Yes.
Okay.
Yeah, Pratima.
Ma'am, it looks like cyan2 L-cell, cyan1 to L-cell, because there is light acetowhite, the transformation zone is visible, and then there is light staining of acetowhite with irregular feathery-like borders. Not very well-defined borders. It are very irregular, like feather-like borders. So it almost looks like cyan1 with L-cell.
Can you give a score to this?
The score of Reed's index or Sweet, it's 0 to.
Yeah, we don't use Reed's index now. Okay, anyone to challenge her?
0 to 4, ma'am. 0 to 4, less than 4.
Okay.
Okay, other teams, team 2 and team 3, do you want to challenge her? So this is a VIA. No? Then I'll reveal the answer. So VIA positive, suggestive of high grade. Okay. So this is thick acetowhite, and I agree with all the other explanations. And this is actually signifying high grade.
Yeah, and the left side border you can see it's slightly raised also.
Exactly. So Bhagya, you have to decide whether to give them marks or not. Because they said L cell, and the answer is H cell.
Yeah. So unfortunately they'll have to give up 200 marks.
Okay. Okay, so now 1 minute each. Now team 2, Usman, quickly collect.
Scene 1, 200.
Your time starts now. $30 seconds over.
Ma'am, she should underwent LETS or LEAP procedure for the excision of lesion.
Okay. Anybody wants to challenge Usman? So this is a 30.
We should have colposcopy plus LEAP.
The first leap should be done, and if the leap shows more than CIN3 or carcinoma in situ, then she should be further workup. As per the WHO protocol, if the patient is HPV positive and the in the triaging VIA is positive, she should be treated on the basis of she is candidate for ablative or the excisional. If she's not the candidate of the ablative procedure, she should underwent large loop excision of transformation zone. This is the WHO recent protocol.
Okay, I agree with Usman that if somebody is not eligible for ablative treatment, there should be LETs. This is WHO guidelines, which is taking into account that colposcopy might not be readily available everywhere. So if you have done a primary screening test with HPV, you've done a triaging with VIA, and if they both are positive, then you assess for ablative treatment. If the ablative criteria are not fulfilled, she should go for excisional treatment. So Bhagya, do you agree?
Yes.
Okay, so I will give them marks. Now team 3, we just have 5 questions left and tough competition going on. Neck to neck. Team 3.
We will take a vaccine 100.
Your time starts now.
Less than 15 years.
So you just have 1 minute.
There should be it should be 2 doses has to be taken, and the interval between the first and the second dose should be more than 5 months. More than 5 months, less than 15 months.
Okay, who was this? Team 3.
Yes, ma'am.
3.
So you are absolutely right. So if ideally it should be given less than 15 years, so then you don't have to give the 3rd dose, but there will be only 2 doses. The schedule should be 0 and 6 months. It should not be less than 5 months. So you get the 100 marks and you are at 300. So you are the lead. And now team 1 again. We did this, isn't it? Yeah.
The time starts now.
Why it's not disappearing?
We have not revealed the answer.
Oh yeah. They gave the right answer, so I forgot to change it. Okay, now. Team 1, Pratima.
Ma'am, screening protocol 100.
The time starts now.
Ma'am, because less than 30-year-old women or girls will be having a high incidence of HPV infection, about 60 to 70%. And then they usually get cleared by 24 months, within 2 years. So that is why HPV testing is not recommended. Otherwise, unnecessary false referral to the colposcopies can happen. So that is why we don't.
Anybody wants to challenge Pratima?
HPV testing. Yes, ma'am.
Anybody wants to challenge Pratima?
No, ma'am.
No one should. So correct answer, please. Show the correct answer. Yes. Yes.
So she was right. There is high prevalence and it is transient.
Yeah, we gave her 100 marks. 100 marks.
It looks like a tough competition.
Yeah.
So, ma'am, VIA
So I think
100.
for team 2, it's let me choose the question. Yes, VIA for 100.
Time starts now. "30 seconds up."
Come on, Usman and team.
Last 10 seconds.
There is no AC to white change.
Time up.
So this is a negative VIA. You were right. There's no.
Yes, he's right. He gets 100 marks.
Yeah. So last two questions.
Caroline, yes. Caroline.
Yes, ma'am. We will take CAN 1.
Your time starts now. $30 seconds up.
Ma'am, there are 3 management components. One is conization with complete endocervical component, and one is second is trachelectomy, and third would be the hysterectomy if there is a patient with atypical glandular abnormalities. In the conization, I would like to specify about the cylindrical cone, which we'll be doing in this case.
Anyone to challenge?
Yes, ma'am.
Yes, beta.
The three component for AGC is first colposcopy and biopsy with endocervical sampling and with endocervical sampling with endometrial sampling, and then we go for further treatment.
Who was this?
Pratima, there are 3 components.
Who was this?
Pratima.
Team 1. Okay. Let me reveal the correct answer. So Pratima was correct. What we mean by atypical glandular cells in the pap smear. So if you have atypical glandular cells, then you have to do endocervical biopsy, colposcopy, and endometrial biopsy, because the glandular cells could be coming from anywhere in the genital tract.
Oh,
so
okay.
This was the correct answer. So team 1 gets 100 more, and team 2 gets minus 100. So this is, I think we should stop now because we just have one question left. Oh no, oh my God. Oh no. All
are winners. Dr. Alia,
All are the winners.
We should stop here. All of them have won. So
okay.
I think
yeah, I didn't realize that all of them are
all of them have done equally well. We can just show the last question just for everyone to know, but all of them are winners. So congratulations to all the teams. And
so let's see.
All of you will get certificates and the prizes will be announced soon. Yeah. So we have your email ID, so you'll get the certificates.
So anybody can give the answer if they have the answer. You'll not get any marks for it because we all have decided the winners.
So ye KBC and you all have quit the game. So now, yeah, and all the lifeline is gone. So you just have to experiment on this.
Ma'am?
Yes.
Hello.
It
is just like if anytime when we do colposcopy, we have to look for whether the colposcopy is adequate or not adequate, if it is satisfactory or not satisfactory, if transformation zone is visible, squamous columnar zone is visible, and then we'll have to see. Yeah. This is the first in IFCC classification. Yes.
Yes. So Pratima gave the right answer whether colposcopy was adequate or inadequate. So that's the key piece of information we as providers need to know. So thank you, Pratima. So
congratulations
again. Congratulations to all 3 teams.
And look forward to meet you all in yet another very, very exciting session on something else than cervical cancer.
So right? I just need raise of hands if we get another quiz in for some other topic. How many of you would like to participate? So raise your hand if you think that this was exciting and you would like to participate. Almost all are participating. I'm sure that next time you'll all be more well-versed with Kahoot. And
Kahoot and Jeopardy, both.
Jeopardy. Which one you
and
enjoyed?
How to make teams, I think, yeah.
Yeah, which one you enjoyed more, the Kahoot or the Jeopardy? Because most of the people didn't play Jeopardy, but...
Yes, I think you can unmute everyone. So let's have a 2-minute talk and then we can stop.
Okay, ma'am.
And Dr. Alia, you can stop share screen so that we can have a...
I did that, yeah.
Yeah.
So, anybody has any burning comments or this thing? So did you all enjoy?
Yes, ma'am.
Can you all have your camera on so we can have a screenshot of gallery?
Yeah, please.
Please open your camera so we can have a screenshot of everybody. Carolyn, can you please open your camera for just 1 minute? Tahira is there.
Yeah, Sadhya madam, are you there?
No, I think she's not there. So whoever can open their cameras for just 1 minute, it would, oh my God, we see such beautiful faces.
But we are not able to open our cameras, ma'am. We don't have access.
Yeah, I think, Saiti, please allow them camera and voice, audio, video, everything for 2 minutes, okay. So
Alia, I am there, but I'm sorry, my Hulia is not for the camera right now.
Oh, it's okay. You have your
I've really enjoyed this quiz.
Thank you, madam. Thank you so much for being there through for such a long time.
Actually, Dr. Alia,
enjoying
Jeopardy
it. Thank
round
you.
is very exciting.
Yeah, Saiti, can you take pictures of this screenshot of this everyone's camera on?
Sure, ma'am.
Yeah, so she can share it also. And I think in a day or two, Shaiti will also help us in making the certificates. It will be sent to all of you and you can download. So again, congratulations to Pratima, Usman and Caroline, who were real leaders. And they have again led 3 teams with them. So, and when all of them have done well.
Thank you so much, ma'am.
So we could see Usman again. So congratulations, Usman.
Thank you, ma'am.